Okay, so does the federal government's pitch address the concerns of those working on the front lines of a healthcare system many say is in crisis? Claudette Holloway is president of the Registered Nurses Association of Ontario. Claudette Holloway, I wonder if we can start with what's being offered to the provinces here by the federal government, and whether you think the money and the plans that have been tabled can really make a difference people will notice in the health system.
Well, from what we've heard, they've received approximately 46,000 million over what they have previously offered. But we also have to realize that that needs to be targeted to building up our healthcare system, particularly in human resources, of retention of nurses and other healthcare workers. We certainly need the money. We have a lot of demands, but we also need to be very targeted as to where these funds would go. We know we have lots of backlogs, surgeries that need to be done, and we want to see that our healthcare system is responsive. For example, having a 24/7 healthcare system where people can get the attention that they need in publicly not-for-funded facilities, which might include specialized clinics that deal with these things. Yes, so it's very important that we also realize the provincial government had some surplus funding, and we need our provincial government in Ontario to state clearly where they are spending that money, and then how the additional money from the federal government will be targeted.
Right, so there's 46 billion new as part of the 196
billion. That's
federal,
right.
Yes, well, 1,000 millions is another way of saying it, but yeah, 46 billion that they're going to transfer over the next decade. So we know the nominal amount the federal government is putting on the table. We don't yet know how the provinces will respond with what increases they'll put in. They'll do that on a year-by-year basis. But what's missing here in terms of what you've seen? We've heard a lot of criticism from people like federal NDP leader Jagmeet Singh that this won't address the nursing shortage and the doctor shortage. How do you think this money needs to be used to fill those gaps?
Well, again, the only way that we can be sure that it makes a start, I mean, it is an increase and it's a start in the right direction. But there's a lot of needs. We know there are millions of Canadians without family doctors, and we know that we have a number of nurse practitioners who can help the situation. So working the system broadly to include nurse practitioners, include RN prescribing to provide Ontarians and Canadians the access they need to public health, and work in hospitals, long-term care, primary care in particular, mental health. There are so many needs that we have some money, and it's a good start, but we know that we need a long-term care plan. We've heard about 10 years, but we want to see that money is consistently going to be there, because as we can see, needs continue to go up, and we need to make sure that the funding would go up along with that. Right,
so many needs, but as you know, not enough nurses, not enough doctors, not enough nurse practitioners, not just in the system, but out there ready to be hired, right? I mean, so what do you want to see with this money in these plans to increase the pool of nurses, of doctors and nurse practitioners, and get more people trained in these critical areas?
Well, we have received from the Ontario government, we've seen an increase in seats in education for them. We've seen an increase for nurse practitioners, et cetera. And we know that people are applying in greater numbers than before. But we also want to make sure that strings are attached so that we can build for the careers for nurses in this province and in this country. Because if we don't have fair compensation, competitive compensation, then our nurses are going to leave the provinces, they're going to leave the country. And, the only way we can remedy that, considering what we've come through with the pandemic, competitive compensation and workloads that are fair, workloads that are manageable to decrease the stress and burnout of our nurses. They've given so much over the pandemic. They continue to be committed, and we really need to show them our respect and show them that, we are really understanding that nurses, in addition to all the healthcare workers that we have, that nurses are the backbone of the healthcare system.
No, and we have certainly seen the burnout concerns and complaints over the last couple of years, and the abuse that people took just going to work at the hospitals. But some of the burnout, people who don't want to work in the hospital system, the public system anymore in Ontario, they may soon have this option to go to these private clinics, right? That Premier Ford is talking about. So what are your concerns there in terms of workforce retention and recruitment away from the public system? And should Ontarians be worried about that if these clinics can get them a better outcome?
I think that Ontarians should be very concerned. All Canadians should be concerned because the private clinics are focusing on those investors. But there's no guarantee that quality will be upheld. In fact, research has shown that there's probably a decrease in quality because the focus is on profit. So we really want to make sure that not one single penny goes towards any private facilities. We want to uphold, we're dependent on our provincial government, we're dependent on our federal government to uphold the Canada Healthcare Act,
right,
where we have a publicly funded not-for-profit system for all.
But we do have...
We don't want any Canadian to be left behind.
No, I certainly understand that, but you know, family doctor clinics are private operations. They are private companies with a profit motive that are paid for from the public sector, and they look to make money that way. If these clinics Premier Ford is talking about are essentially a surgical version of your standard family doctor's office, what would be wrong with that?
Well, we already have specialized clinics that are in the not-for-profit system, so we're fully advocating that that could expand, but we do not support any type of private funding for clinics that are doing private for profit. That is absolutely unacceptable to us. So the bottom line is that with what we've heard is that we have not had any protections in place to say that private for-profit clinics would not try to peddle in it. You know, they're saying they can go there and get their health care with their health card, but there's nothing to protect them from being offered and making it seem that they must have these add-on services which are for free. So the best way is let's move the focus away from private to a publicly funded system where we can be sure that all the dollars are invested in Ontarians. And we know that if we frit away the money to private clinics, then there's less impact for those that are trying to deliver care through a not-for-profit system under our Canada Health Act.
Okay, Claudette Holloway, thank you so much for your time.
Thanks so much for the opportunity.